Welcome to HealthCast. I'm your host, Sarah Seibert. GovCIO Media and Research is live here at the 2022 HIMSS conference in Orlando. Throughout this week, we'll be releasing special episodes, catching up with federal leaders at the show across our podcast platforms, including GovCast and Cybercast. Today, we're joined by Holly Joers, Program Executive Officer of Defense Healthcare Management Systems at HIMSS 2022. She's going to dive into her session on enhancing electronic health records. Thank you for joining us today.
Thank you so much for having me.
Yeah, so I learned some exciting news yesterday during your session. Not only are you a Nats fan, but you're also in your final site rollout. So that's exciting. Congratulations.
Yeah, well, we just kicked off the final site rollout. So we've got about 12 what we call waves in flight. And so that is, wave is like a collection of our sites, a cohort that's going live together. And so our deployment phase for change management adoption is about a 15-month timeline. So we just kicked off the last CONUS wave, when I say, in the U.S., and then we're getting ready to go overseas. So we'll be finished in about 18 months.
That's so exciting.
Very excited. It's a huge milestone.
Yes, it really is. So as you're wrapping up CONUS and getting all the systems in place, what are some of the technologies you're using to enhance workflows and continually build to improve?
Well, it starts, a lot of it is foundational, right, with the standardization of workflows. So in order to optimize, you really got to start with that standard. I think there's many folks here who have talked about, different sites do different things, and then you start to look at how can you take those best practices and create a great enterprise standard. So we start with a foundation, and then we start to look at where do we have gaps, where do we need to optimize, or where are there great innovative ideas out there. As we just went live in San Antonio, we really started to pull trauma, burn, ECMO, those new workflows onto the system, and I think that is a tremendous opportunity for them to actually get some of those critical high acuity care into the record. We established MHS Video Connect, which we talked a little bit about in the session yesterday, but I wanted to expand a little bit on it because it enables us to do not just patient to provider video visits, but we can start to do provider to provider. And how can we get consultative care from specialties in a really, we're distributed nationwide, right? And so what you have in maybe Minot, North Dakota may not be the same specialties that you have in, say, a large area market. So how do we start to leverage that? How do we leverage it for readiness, behavioral health, right? How do you start to really break that stigma of coming in somewhere for behavioral health and really expand those opportunities? So we're really exploring a lot in that virtual health space and extending it as part of the workflow. So it's really important. I think we talk a lot about tools and innovative tools, and it's great. Obviously, we're IT people, right? We like to talk about tools. But really it's about how do you make those almost invisible so that they're an extension of the workflow, so that if it's a provider to patient interaction or even a large group behavioral health, like that we're enabling that without making the tool the center of it, right? That's an extension, and that it's not a separate activity. It's just a natural extension of how they're going to do their business. And that's kind of a paradigm shift, from thinking of virtual health as this separate thing to an extension of workflow. So those are just a few. I could talk, I know you probably have a few more questions for me, but talk registries, really looking at, I think I touched on this as well, but registries, how we start to connect different elements of data to drive clinical care and clinical decision making. So if we've seen it with COVID, with the trauma registry. If you start to look at someone who has other comorbidities or other risk areas, and you can pull that data together, you're like, oh wow, that person needs to get into therapy right now. We were able to pull that information together with a registry to see it. So how can we expand that to other predictive tools when you start to look at diabetes or opioid management or other areas? So anyway, I'm very excited but it's starting with getting those enterprise standards and then optimizing. And so I'm super excited about what the single common record brings to the table there.
Yeah, that's really, really exciting, and I look forward to seeing how those tools develop. And as you just mentioned, and I know you mentioned in your session yesterday too, it's not about the tool necessarily, but having that paradigm shift. So how are you implementing change management to make sure that it's not just another tech tool and it becomes part of the
It's
foundation?
really, adoption and understanding the why. We all have to have, we're in an IT world right now, right? We all use these tools to do jobs, whether it's your Microsoft Suite for your system or now, starting to use Zoom and all these other activities to do our jobs. And well, in the clinical community, it's how do we do it for coordinated care, right? That's first and foremost. How are we looking at it from what that coordinated workflow and making sure people understand this is not just building a document, right? A lot of people, I think it's a misnomer when we say electronic health record, because people think of it as just, here's my list of things in my record. It's really about how you deliver care. And so that's one of the first things we talk about, right? You are not building a document. You are caring for a patient that happens to build a document at the end, right? That's the first thing we talk about. And then we have these things called commanders workshops, which, it sounds okay. What do you do? Well, we build a cohort. So I talked about the waves coming together. We talk to them early on. This is what you can expect. This is why we're doing it. We bring in commanders from previous sites. This is the experience I went through. I sat through this. I heard it all. Here's what I didn't listen to. Here's what I did listen to, right? Those lessons learned. So they're not just observations. We're actually pulling those lessons from the individuals who went through the experience and being able to shape that. So it's not just me from a program perspective saying, this is what you should do, right? We're hearing it and building it from the ground up. And we lay expectations out. It's sort of this anxiety driven thing. Oh my gosh, I'm going through this huge change, right? Well, how do we break it into steps? Month by month, here's what you can expect. We have a suite available for them to see, okay, here's the comms things I should be doing. Here's what I should expect each month. And then have that phone a friend relationship, right, to be able to help them through it. So that's one piece. And then from a deployment perspective, we create a program, we call it Pay It Forward. It's, again, sounds pretty obvious, but it's taking those end users from sites or super users from sites and bringing them to the next site so that they're at elbow with those folks. And a lot of it is confidence building. Yep, you're doing it right? You know what I hate to say, right? So because you have so much anxiety, we forget that human nature. I mean, everybody wants to say, oh, the resistance to the change, but there's just, am I going to be able to do my job well? Is this going to keep me from doing my job? So some of it is actually, helping with the system, but a lot of it is building their confidence in using the system. And so once the providers are confident that they can do their job effectively, it changes the whole paradigm on how they use it. And then we start talking about those real capability needs, right? Versus just using the system. So that's one aspect. And then, we talk about training and there's no perfect training way to do this, right? So we kind of have you see it, you hear it, you do it mentality, right? And that's pretty standard, especially repetition for adult learning, right? You hear it over and over again, right? I know I need to hear it 7 times, 7 ways, right? And so we have a pretty robust process for that. And the biggest thing that I have seen is we've got this data behind us now, and we can start to actually use our own analytics to see where we're going to have risk areas. So I can look at adoption metrics and see, okay, there's a specific department or clinical specialty that we really need to concentrate our resources on because I know that there's a risk area here. And again, it's not a scorecard to grade people. It's really so we know where to help people. And I think the biggest shift is when we talk to those commanders, it's really about us helping them. Like I said, it's not a scorecard. I'm not grading you on what you're doing. It's how can I help you? I'm here to do this with you, not for you, not to you. Again, easy to say, but it just becomes part of that. It's all about human nature and easing anxieties and making sure people are comfortable with their job and are job ready. And again, sounds oversimplified, but it's any enterprise IT, right? We tend in the IT world to focus on here's some buttons you need to click and here's what you need to do. And it's really about transforming how you think about your job. So
That's a great answer. I know having that engagement and feedback is essential to building trust in a system as well as the leadership as well. So that's great to hear.
Yeah, the secret sauce, the leaders on the ground. I said it yesterday. It really is. I can't stress it enough. We've seen it time and time again. Some phenomenal leaders that are really, they understand the why. That's good.
So as you're working to build communications and share these lessons learned with VA or, the providers as well, like how is the Joint Health Information Exchange helping in that?
It's one of the things I'm so excited. What I've seen in the last 2 years with, we launched the Joint Health Information Exchange. Both DoD and VA had exchanges previously, different levels. But when we came together and created that single door, we call it like the single door that people need to knock on to get information and for us to share information, it really changed. It was a game changer. And so I think we're covered about 65 to 70% of hospital networks now with the exchanges we're currently on, and we're bringing on care quality later this year, and that's going to take us to about 90% of hospital network coverages. So now you start to look at, okay, there's still an adoption challenge, right? So how do the providers know what's there? How do you take that to the referral management office? How do you start to integrate those things? So, it's one thing to say, yes, the data is now available, but people have to use it. And one of the most exciting things we're starting to do in improvements there is get to a capability where we get more computable data and trusted partners. So once we have trusted partners, the doctor will no longer have to reconcile that data, right? So it'll just be there. So today, that information is available, and they look at it and say, "Yep, that should go in the record," because everybody has different quality of data standards, right? From an IT perspective, you don't want to bring bad data in, so there's a way to look at that. And what this is going to bring with the trusted partner framework is that the doctor, the joint HIE will go out, prefetch information the night before an appointment, and it'll already be in the record when a doctor pulls it up. So we're bringing that on board. I mean, I feel like we have barely tapped the potential there for what that brings to the table.
That is so exciting. I look forward to seeing how that evolves. So moving forward, what are some things that you're most excited about or looking to progress?
Well, I think the partnership with the VA, how we look at converging our workflows, how we look at joint sites, to see, because there is, I think, Mr. Chinston talked a lot about, he talked yesterday about the James A. Lovell Federal Healthcare Center in North Chicago, really integrated site, but there are sharing sites all over the country where DoD and VA are working together in partnership to do community care. And so as we start to make that easier on the provider, easier on the patient, looking at optimizing like our patient portal, how do we enhance that patient experience, right? That's the, one of the next things. Where do we look at those things that the patient is experiencing, sort of shift our gear from, adoption from the provider to enhancing that patient experience. And so I think we're just starting to really look at what the possibilities are there. And I love being here and seeing all the great things that all the industry partners have that really focus on that patient experience. It's pretty exciting.
Yeah, it's great to see. Some of the things I've seen walking the floor is just mind-blowing. And the espresso machines, have you seen? Yeah.
Hot cookies. Espresso.
Yeah. Well, thank you so much for joining us today. It was great to hear about some of the improvements you've made to each EHR, and I look forward to seeing where it's headed.
All right. Thank you so much.
Thanks for tuning in. Follow our other shows for more coverage throughout the conference this week. You can head over to govciomedia.com to find more HIMSS insights and to subscribe to our newsletter.
HealthCast, along with GovCast and CyberCast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them in your favorite podcast platform, and if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@gcio.com.